Understanding a woman's fertile days and safe period, a complete guide. Did you know that a woman is only fertile for a few days each month? Understanding these fertile days, and the so-called safe period, can help couples either avoid pregnancy naturally or increase their chances of conceiving. But here's the thing, most people get it wrong because they rely on myths, guesses, or outdated advice. In this video, we're going to break it all down step by step, using science, not superstition. By the end, you'll understand exactly what's going on in a woman's body each month, how to track fertile days accurately, and what pitfalls to watch out for. Before we dive in, go ahead and subscribe to our channel, hit that like button, drop your thoughts in the comments, and share this video with someone who needs to hear it. And don't forget to tap that notification bell, so you never miss our latest updates on health, relationships, and natural fertility awareness. Section 1. Understanding the menstrual cycle. First, let's talk about the menstrual cycle, the foundation for understanding fertility. The menstrual cycle is counted from the first day of bleeding, your period, to the day before the next period begins. On average, a cycle lasts about 28 days, but it can be as short as 21 days or as long as 35 days, and still be considered normal. The cycle has 4 main phases. 1. Menstrual phase. This is when bleeding occurs. The old uterine lining is shed, lasting typically 3 to 7 days. 2. Follicular phase. The brain releases follicle-stimulating hormone, FSH, to help the ovaries mature eggs. Estrogen levels rise, preparing the body for possible pregnancy. 3. Ovulation phase. This is the big moment. Around the middle of the cycle, a surge in luteinizing hormone, LH, causes the ovary to release a mature egg. This egg can survive for 12 to 24 hours. 4. Luteal phase. After ovulation, the empty follicle transforms into the corpus luteum, producing progesterone to prepare the uterus for implantation. If no pregnancy occurs, hormone levels drop, triggering the next period. Why is ovulation so important? Because it's the only time each cycle when a woman can get pregnant, and it doesn't last long. Section 2. The fertile window. Here's the key. A woman is most fertile in the 5 days before ovulation and on the day of ovulation itself. This 6-day span is known as the fertile window. Why 5 days before? Because sperm can survive in a woman's reproductive tract for up to 5 days under the right conditions. That means if you have sex in the days leading up to ovulation, sperm can already be waiting when the egg is released. After ovulation, the egg lives for only about 24 hours. If it isn't fertilized by sperm during this time, it disintegrates and can't lead to pregnancy. So, if you're trying to avoid pregnancy naturally, the days after ovulation until your next period are often referred to as the safe period. But here's the catch, this works best only for women with regular, predictable cycles. Section 3. Safe days explained. Let's define the 2 key terms clearly. Fertile days, the days when pregnancy is most likely to happen. Safe days, the days when the chance of pregnancy is very low. For a textbook 28-day cycle, fertile days are roughly day 9 to day 14. Safe days are typically day 1 to day 7, during and right after your period, and day 15 to day 28, after ovulation. But remember, real life is rarely textbook perfect. Stress, illness, travel, and even sudden changes in routine can delay or speed up ovulation, which changes the timing of your fertile and safe days. Section 4. How to track safe days using the calendar method. To estimate your safe and fertile days using the calendar method, here's what you do. 1. Track your cycle length for at least 6 months. Write down the number of days from the first day of one period to the day before the next period. 2. Find your shortest cycle and subtract 18 from that number. The result is your first fertile day. 3. Find your longest cycle and subtract 11 from that number. The result is your last fertile day. Example. Shortest cycle, 26 days 26 to 18 equals day 8, first fertile day. Longest cycle, 30 days 30 to 11 equals day 19, last fertile day. In this example, days 8 to 19 would be your fertile window. Any days before day 8 or after day 19 are safer for unprotected sex, but again, it's not 100% guaranteed. Section 5. Tools and techniques for better accuracy. The calendar method alone can be risky if your cycle is irregular. For better accuracy, combine it with other fertility signs. Basal body temperature, BBT, charting. Your resting body temperature rises slightly after ovulation. Cervical mucus monitoring. Fertile mucus is clear, slippery, and stretchy like raw egg whites. Ovulation predictor kits, OPKs. These detect the LH surge before ovulation. Many women also use fertility apps that combine all these data points for more precise predictions. Section 6. Limitations and precautions. Natural fertility awareness works best when cycles are regular and when you're willing to track your signs daily. But there are limitations. Irregular cycles make predictions less reliable. Hormonal imbalances like PCOS can cause unpredictable ovulation. Life factors such as stress, illness, or travel can shift ovulation timing. Postpartum and breastfeeding can delay ovulation but make cycles unpredictable. If avoiding pregnancy is crucial, pairing natural methods with barrier methods, like condoms, is a safer approach. Section 7. Practical tips for success. If you're tracking fertile days for pregnancy prevention, avoid unprotected sex during your fertile window. Track your cycle length every month without skipping. Combine at least 2 fertility signs for accuracy. If you're tracking fertile days for conception, have sex every 1 to 2 days during your fertile window. Maintain a healthy weight and lifestyle. These can affect ovulation quality. Don't rely on timing alone, focus on overall reproductive health. Section 8. Myths versus facts. Let's clear up a few common myths. Myth: you can't get pregnant during your period. Fact: it's rare, but possible, especially with short cycles. Myth: all women ovulate on day 14. Fact: ovulation can happen earlier or later depending on cycle length. Myth: the safe period is foolproof birth control. Fact: it's only effective when done correctly and consistently, and even then, there's a failure rate. Section 9. Closing and call to action. So, whether you're looking to avoid pregnancy naturally or maximize your chances of conceiving, understanding your fertile days and safe period is key. Remember, knowledge is power, but accuracy comes from consistent tracking and combining multiple fertility awareness tools. If you found this video helpful, give it a thumbs up, share it with friends, and don't forget to subscribe for more science-backed health tips. Drop your questions in the comments, we read every single one.